As the coronavirus continues to storm throughout the world, and with the vaccine finally here, the question arises, who gets the vaccine first? Everyone has the right to get the COVID vaccine, but not everyone can get it at once. So how do we decide who has the right to get it first? And is it ethical to give it to one group of people over another? Here we're going to focus specifically on the equity and ethics of this proposed vaccine delivery schedule in Saskatchewan. The original vaccine delivery schedule in Saskatchewan was divided into different phases. The first phase consisted of vaccinating healthcare workers in this order: long-term care homes, adult ICU, emergency department, respiratory therapy, COVID-19 designated wards, Code Blue and trauma teams, EMS road and air, and finally, all healthcare workers over the age of 70. It would also vaccinate vulnerable populations in this order: residents of long-term and care personal homes, residents of First Nations communities over the age of 40, then anyone over the age of 80 and Indigenous adults over the age of 60, then anyone over the age of 70 and Indigenous adults over the age of 50, then patients receiving organ or stem cell transplant, and finally patients on dialysis. The government of Saskatchewan, along with Health Minister Paul Merman, decided on this plan. The first problem I see with this is it's not protecting all of our nurses and doctors who provide our health care. Without our nurses and doctors, we have no one to care for the sick. How can this plan be ethical when many other healthcare workers are being left out, as well as our essential workers, including teachers, grocery store workers, bus drivers, daycare workers, and more, who could all be in direct contact with the virus? According to the government of Saskatchewan, the goal of the immunization program is to protect the most high-risk and vulnerable, minimize serious illness and death, protect the capacity of the healthcare system, and minimize the spread of COVID-19. On February 9, 2021, the Saskatchewan government released a Phase 2 vaccination plan. This plan focused on age groups for the next vaccinations, as well as adults in staff group homes, shelters, and other vulnerable adults, but it neglected to prioritize healthcare workers. The president of the Saskatchewan Union of Nurses was quoted as saying, "Registered nurses have been working non-stop for a year, and the vaccination was a light at the end of the tunnel. And now that they're not getting the respect they deserve to be put in Phase 2, it's disappointing." There was so much complaint that healthcare workers were left out of the vaccinations, and on February 16, 2021, the government decided to change the decision and will now include most healthcare workers in the Phase 1 of the vaccine delivery. It can be hard to prioritize groups of people to receive the COVID vaccine in a fair way. You can't blame the government of Saskatchewan. The vaccines are in minimal supply and they can't give them to everyone at once. Although everyone has the right to get the vaccine, the government has a responsibility to decide where it goes, and they have done their best to be ethically right.